Welcome to This Explainer. Today, we're diving into a high-stakes, honestly kind of invisible world that literally keeps our entire global medical system running. It's an industry that rarely makes the front page, unless of course something goes terribly wrong. We are talking about the vast and complex mechanics of the healthcare supply chain.
I mean, just think for a second about the sheer volume of pharmaceuticals, the highly complex machinery, and all the critical medical devices moving around the globe every single day. It's staggering. So the question we really have to ask ourselves is, who actually holds this massive supply chain accountable when billions of dollars and potentially millions of lives are on the line? It's a fascinating, deeply complex ecosystem, and we're going to unpack it.
But to understand this accountability, we first need to get on the same page about who we're actually talking about here. Healthcare distributors are these massive entities that purchase, inventory, and sell pharmaceutical products and medical equipment directly to hospitals, pharmacies, and physicians. They are essentially the ultimate middlemen. Without them, the gears of the entire healthcare sector would just, well, they'd grind to a complete halt.
All right, let's move right into Section 1, the ethics of distribution.
So stepping away from the physical logistics, the warehouses and the trucks, and moving into the complex web of corporate morality, the most crucial thing to realize is that this sector absolutely does not operate in a vacuum. Because of the vast amounts of money changing hands and the severe public health implications, distributors are heavily scrutinized. They are bound by incredibly strict jurisdictional laws that are specifically designed to target three major ethical landmines: false marketing claims, bribery, and corruption. And let me tell you, tripping one of these landmines isn't just a bit of bad PR. It is a massive financial liability.
Okay, let's actually dive right into this. The SASB Sustainability Disclosure Topics and Metrics for Healthcare Distributors serve as the gold standard here. Investors use these exact standardized metrics to measure a company's real-world exposure to those ethical risks we just talked about. It's a real game changer because it effectively takes this abstract, fuzzy concept of good business and turns it into hard, highly quantifiable data points.
Which brings us to Section 2, Drafting the Code.
To prove they are actually managing these risks, we look at the very first key metric, which focuses on a company's code of conduct. Now, a vague corporate promise to just do the right thing absolutely doesn't cut it anymore. According to the SASB standard, a distributor's code of conduct needs serious teeth. It has to explicitly cover four very distinct areas: business competition, business intelligence, interactions with government officials, and marketing. What's really interesting about these four target areas is how surgical they are. By focusing right here, the code directly tackles the specific environments where things like bribery, kickbacks, and false claims are most likely to fester.
But just writing up a code of conduct and burying it in a PDF on the company intranet, yeah, that's not enough either. The metrics demand total transparency on the actual scope of that code. Companies have to publicly disclose the specific types of staff the code applies to, as well as the exact percentage of the workforce that's actually covered by it. Are the C-suite executives playing by the exact same strict rules as the regional sales reps? Investors need to know precisely who is held to these standards within the whole shebang. Let's shift gears to Section 3, Enforcement and Compliance Mechanisms. We're moving the narrative arc here from the pristine theory of writing a great rulebook down to the hard, boots-on-the-ground reality of actually enforcing it across a massive global supply chain. How do abstract rules become concrete actions? Well, the disclosure requires companies to detail their enforcement mechanisms, which generally breaks down into three rigorous steps. First up, establishing dedicated compliance or review committees. Second, conducting regular, unannounced internal inspections. And third, having crystal clear protocols to implement corrective action the very minute a code is violated. Without these active steps, honestly, the code of conduct is just useless paper.
And of course, you literally cannot enforce rules if your team doesn't truly understand them, right? That's exactly why the standard also mandates that companies discuss the scope, degree, and frequency of their education and training. It has to be a continuous process to ensure that every single employee, whether they are negotiating a multi-million-dollar contract with a manufacturer or just managing a local distribution hub, fully understands their compliance responsibilities.
Now for the heavy hitter, Section 4, the true cost of corruption.
So, what happens when all those systems fail? This brings us to the second major metric, which raises the stakes significantly. We're looking at the severe financial consequences that hit the ledger when a company fails to uphold these ethics. When a distributor gets caught up in a legal proceeding tied to bribery, corruption, or unethical practices, they have to open the books. And the way the accounting works here is brilliant.
The standard requires the explicit disclosure of all monetary liabilities paid to opposing parties. Things like fines, settlements, and trial verdicts are all included. However, it specifically excludes the company's legal fees and defense expenses. This is crucial because it ensures that anyone looking at the books sees the actual penalty paid for the bad behavior, completely unclouded by the cost of the expensive lawyers hired to defend it.
Now, these financial penalties can stem from a few different places, which we can categorize into 3 distinct buckets to cut through some of the legal jargon. First, you have civil actions, which usually result in civil judgments or financial settlements. Second, regulatory proceedings. These can lead to regulatory penalties, restitution, or something called disgorgement, which is essentially the forced repayment of ill-gotten gains, basically coughing up the profits you made illegally. And third, criminal actions, which carry severe criminal judgments, further penalties, and mandatory restitution.
Here is where the transparency becomes truly uncomfortable for a non-compliant company. Beyond just reporting the sheer dollar amount of the loss, the standard dictates that they must publicly spill the dirty details. They have to disclose the exact nature of the loss, like was it a quiet settlement, a deferred prosecution agreement, or an outright guilty plea. They also have to provide the context. Was this a case of deliberate fraud, or were they making false marketing claims? And crucially, they have to detail the specific corrective actions they've implemented to fix the root cause.
And listen, those corrective actions, they are rarely just minor tweaks. When a healthcare distributor gets hit with these kinds of penalties, the required response almost always involves massive internal overhauls. We're talking about fundamentally upgrading daily operations, firing and replacing key management figures, totally redesigning compliance processes from the ground up, cutting ties with lucrative but toxic business partners, or investing heavily in brand new tracking technology just to ensure a clean supply chain moving forward.
It really all boils down to this core idea from the SASB standard. Entities that ensure compliance with relevant regulations may avoid litigation, which could result in costly fines or settlements. The absolute crucial takeaway here is that in the healthcare supply chain, ethical compliance isn't just some lofty moral ideal to strive for, it is a strictly measurable financial imperative. Operating ethically protects the bottom line, for sure, but operating corruptly, that actively destroys shareholder value.
Which leaves us with a pretty critical thought to end on today. We've seen exactly how the rules are written, how the scopes are defined, and how the financial penalties are strictly tallied up on the balance sheet. But when a single false claim, a bribed official, or a compromised supply route can cost millions and directly impact patient care, is corporate transparency just an option for these massive distributors, or is it literally the only true way to protect the integrity of our global healthcare system? Thanks so much for joining me for this explainer. I hope it gave you some powerful new insights into the very real mechanics of business ethics.